A new week and a new way to tackle the virus. England's traffic light system unveiled. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis. If you're in England, your area will soon be classified as medium risk, high risk or very high risk by the government. And from Wednesday, that'll dictate your freedoms. In a bid to simplify the rules, Boris Johnson announced a new model of local COVID alert levels on Monday.
Just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a 3-tiered system of local COVID alert levels in England, set at medium, high and very high.
Places deemed very high risk, that's Tier 3, which includes the Liverpool City region, will ban social interaction indoors and in private gardens and shut pubs and bars. People are also advised against travelling in and out of these areas. The high tier, that's Tier 2, reflects current local lockdown restrictions, preventing people from mixing with other households indoors. And the medium tier, that's Tier 1, will cover most of the country and reflect the current national rules. So the rule of 6 will apply for social gatherings, and venues including bars and restaurants have to shut at 10 p.m. Find out what the restrictions will be in your area by following the link in the show notes to this episode. So to find out how much of a difference this system will make on the day that the Prime Minister confirmed that more people in England are in hospital with the virus than on the day the lockdown was announced in March, I gave Dr Elisabetta Gropelli a call. She's a virologist and lecturer in global health at St George's University of London. And she started by telling me why she welcomes the simplicity of the 3-tier traffic light system.
First of all, I think the most important thing is that we've heard the Prime Minister spelling out the need for simplifying and standardising rules, because this has been a big issue locally, but also nationally. So it's fantastic that something, has been taken on board. And it's quite telling, I think, that it starts with medium, because there is no, first entry level, which is actually, for example, a low level. So it really, this again highlights the situation that we are in at the moment, which is a situation of concern and a situation that requires action.
Do you welcome the fact that this guidance, this 3-tier system, very much focuses on social interactions?
I do welcome the fact that the Prime Minister has been talking about households and interactions, social contacts, because this has a lot of virological sense. Virus spreads from person to person, so it is by controlling interactions of people that we can put a lid on spreading. However, I do have some doubts about, is this enough? Is this alert system, actually this tier system, enough in terms of actions that are required to actually curb the spread? And obviously there will be more details coming out, also especially as the fine print is going to be debated and discussed in the Parliament. But generally speaking, again, if we look at a virus spreading within our societies, yes, it does spread human to human, person to person, in household settings, but also it does spread in other environments, in other settings. And I think this is where the data is a little bit more sketchy, but also where the Prime Minister seems to be simply going in the direction of just tackling social interactions while leaving everything else as it is. And by everything else, I mean education and business.
That focus on social settings that we've talked about, that was one thing that struck me about the announcements on Monday. But the other was the lack of focus on the test, trace and isolate system, which you'd hope would be working in conjunction with these lockdown measures. I don't need to remind listeners that Boris Johnson said that we would have a world-beating test, track and trace system, and now we don't really have one that's fully functional. How damaging do you see that being to public health at the moment?
I think the challenges or the lack of a proper solid test, trace, isolate system is very much underpinning a lot of the challenges that actually the UK and England especially are facing at the moment. So much that we can see, we can trace down to an inability to actually test effectively and then trace. But also, I think the lack of test, trace, isolating system is also underpinning the lack of clarity about why, for example, there is an intervention in the hospitality industries versus other settings. And so testing and tracing was mentioned earlier today about one of the three defenses that we have against the coronavirus, and was briefly mentioned about empowering local authorities with reinforcing testing and tracing and giving resources. Again, however, details were missing. How actually is this going to happen? How also the integration of information that has to be trickling down to the right people locally, but also being used with some details to inform policy. So all of this is still a little bit lacking details, and unfortunately does contribute to consequences and unfortunately the wrong direction of the trajectory of the data that we're seeing.
That frustration about the lack of data that you share is voiced regularly by journalists at the press briefings, today's included, who constantly ask for proof that the virus is spreading in the settings that are going to be affected by local lockdowns, like hospitality. Barely a day goes by, it feels like these days, where they or Keir Starmer, the leader of the Labour Party, the opposition, don't ask the government and their advisors for proof that certain measures will work. But is that proof that the government could realistically even provide? Is that even possible to say, listen, we know these measures are going to work when we say impose a 10 p.m. curfew? Because we've never been in a situation exactly like this set of circumstances now, even if this set of circumstances now is comparable to March. It's not exactly the same.
Yes, I mean, there are certainly reasons when we say we don't know, in the sense that it's an unprecedented situation, but also is not, even if it's a novel virus, we started understanding how it spreads. And so there is a virological logic about if the virus spreads in closed environments, let's prevent people gathering from closed environments. There isn't any specific data about closing pubs or deciding on a 10 o'clock curfew. But we've seen that actually different European countries, for example, have adopted the same measures, because there is some virological sense. However, this virological sense, which is clear, it's unproven, untested. But also, I think it still needs to be guided by the data that we have in sense. If we have information that the vast majority of the new cases in England actually have caught the virus in the hospitality sector, by all means, tackle that. But I don't think the data is there to inform this policy, and also to make sure to show that actually this policy will work. There are some data from other countries, and because I'm Italian, I look at the Italian data a little bit more in details. And in that case, the last week, more than 70% of the new cases, of the new outbreaks actually, occurred in households. So I think, that data is certainly informing policy in Italy, but it would be great if we had an easy or at least a clear presentation of the data, which, however, I don't think is going to be that simple, because it's not just journalists that need to dig around for the data. I have to do that as well. And it looks like, again, the fragmentation of the information and data is not put together in a coordinated way. And I think it's not just the communication that suffers. It looks like policy is also suffering from this.
Moving back onto the three-tier system, how likely do you think it'll be that areas will just veer between all three tiers? We know by now it's pretty obvious that rates rise when restrictions are relaxed. So once you move into, say, tier one, so the lowest tier with the fewest restrictions, is it not just a matter of time before you move back into tier two and then possibly three if we continue to relax restrictions before we have a vaccine?
I think that there is certainly a level of inevitable. Yes, as we said at the end of when we lifted the first draconian lockdown, we were expecting transmission to occur. However, the idea was that, yes, we will see an increase in transmissions, but we will maintain it as localized clusters, because we will go in and curb transmission and keep it to manageable levels. So the idea, if you actually move again from a tier 3 down to a tier 2, would actually be that you must have in place a system that allows you to actually go to tier 2, but then stay there. And so this situation has to be dynamic. There has to be dynamic in the response, but it also has to be clear what actually are the drivers, the criteria to move up, and what needs to be done to move back down. And number of cases are certainly an important factor, but again, we are seeing that hospitalizations, test and tracing are the ones that actually are far more important when it comes to deciding how to act, and also how to sustain this what it is, a chronic situation. We are in a pandemic, it's an emergency, but it's not an acute situation anymore. It's a chronic, with all the fluctuations and dynamic aspects of a chronic situation.
The rest of the coronavirus latest news. NHS Nightingale hospitals in Manchester, Sunderland and Harrogate are being asked to get ready to take patients. Government advisers say admissions are rising, with more elderly people needing urgent treatment for COVID-19. More people are now in hospital with coronavirus than before restrictions were announced in March. 3 million people have missed vital cancer screenings after taking the government's message to stay home and protect the NHS literally, according to Cancer Research UK. New analysis by the charity also found that more than 350,000 people who should have been urgently referred for cancer checks weren't. The charity's warning of lengthening queues for diagnosis and treatment, with understaffed oncology units struggling to work through the backlog. It comes as NHS England's medical director, Professor Steve Powis, urged those who need it to use the health service. China's aiming to test more than 9 million residents of the port city of Qingdao within 5 days, following a minor outbreak of 6 confirmed cases. It's the first mass testing the country will have carried out in months. If you'd like more information on any of those stories, head to the episode description. I'll put links to our full write-ups there, as well as a link to telegraph.co.uk/audio, where listeners can get a 30-day Telegraph subscription completely free. We'll be guiding you through the changing rules and updated guidelines as the UK steers its way through the pandemic, almost 7 months after the first lockdown came into force. I'm not sure whether that's gone incredibly quickly or very, very slowly. Whilst you're there, I can highly recommend a piece by my colleague Sarah Newey. Some of you may have heard her on this podcast. She's reporting from Manaus in Brazil, which gained global notoriety when some rather grim images of mass burials there emerged in April. She's found out what exactly went wrong and whether it could happen again. It's a fascinating read, and there are some stunning, if rather haunting, images in that article. Link to that also in the show notes. If you found today's show useful, please do leave it a 5-star rating and perhaps even a short review on Apple Podcasts, and subscribe to this feed to make sure you don't miss my next update. If you'd like to get in touch, the email address is coronaviruspodcast@telegraph.co.uk, and you can find me on Twitter @T_Louloudis. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis.